Hello, my name is Ellie Abrams, and I am a current third-year doctoral student at Wright State University's School of Professional Psychology. Today, we'll be presenting on my non-empirical research regarding the intersection of neuropsychological assessment and traumatic brain injury, otherwise known as TBI. Today, I will be presenting an introduction of this topic, the results of my literature review, what the research says, and how this information can be integrated into clinical work. The therapeutic alliance is defined as the positive and collaborative relationship between a client and a therapist. TBI is defined as a force on the head, usually from an external medium, that leads to the internal processes in the brain being compromised or changed. Due to neuropsychologists' expertise in not only behavior, human development, and psychology, but brain anatomy as well, their role within TBI has become crucial. It has been recognized that there has been a lack of research done with this topic in neuropsychological assessment. The idea of psychological assessment has historically been described as dehumanizing due to viewing human beings from a pathological standpoint. The therapeutic model of assessment integrates the information gathering model while also bringing in concepts of client centeredness to gain a well rounded view of the client. These concepts are built on building trust, collaboration, and transparency to assist in building rapport with your client. Neuropsychological assessments are used to assess cognitive functioning of an individual and possible deficits that are present. They tend to be longer, more in depth, and more specific than psychological assessments. Neuropsychological assessments' role in TBI is to administer assessments in order to determine what deficits may be present and recommendations to get them back to premorbid functioning or continuing with their new normal. Much of the research done on TBI in psychology is done within the setting of neurorehabilitation. It is suggested that clinicians should receive specialized training when working with individuals with TBI. Therapeutic assessment with a strong alliance throughout the assessment leads to increased motivation for the process and a client's willingness to provide honest and open answers to testing questions. Decreased cognitive functioning, decreased motor capabilities, low frustration tolerance, and other deficits can be informants for test selection for each unique individual. Specific psychological and personality measures are important to include due to the difficulties commonly experienced post TBI, like pain, anxiety, and post traumatic stress. Broad aspects of positive psychology and motivational interviewing show efficacy in neurorehabilitation and potential benefits in an assessment setting with this population. Developing a therapeutic relationship with the individual using curiosity, active listening, and validation of the individual and what they have gone through is crucial to begin from the start. This can be done using reflective listening, exploration of circumstances, and listening to understand to employ curiosity in this setting. Brain injury is likely traumatic for the individual who has suffered from it, therefore, providing empathy for the trauma can exist in developing rapport prior to any testing being done. The therapeutic alliance can be developed no matter how severe the client's cognitive deficits may be, and can be done by providing clients with the structure of the intervention being done, having expertise in TBI, going at the appropriate pace of treatment, and using cognitive testing to inform the way you interact. Although individuals with TBI may have decreased cognitive abilities, it is important to view each client as an autonomous individual. Motivational interviewing is a collaborative therapeutic style meant to be integrated with other theoretical approaches. This focuses on natural human ambivalence. Neuropsychological assessment requires engagement to ensure validity of the evaluation. Therefore, MI principles using non confrontation, collaboration, and self efficacy could help a client with TBI to determine their readiness to change or motivating their own change. Positive psychology focuses on the client's positive experiences and traits to build on that are strengths rather than what one is lacking. Positive psychology principles that may be integrated when working with individuals with TBI are post traumatic growth, coping, resilience, hope, and optimism. This can include allowing space for the negative and positive, believing as clinicians that everyone is capable of positive growth, exploring strengths and limitations of an individual's injury, instilling hope, encouraging independence, and ensuring that an individual has community with other individuals with TBI, which could be within the recommendations section to provide them with more resources. Thank you for listening to this presentation about this important topic. I appreciate your time. Please scan the QR codes Here for my references and poster with further research.